This is your statewide newscast. Arkansas Today.
Cervical cancer rates are increasing among women in their 30s and 40s, and more than half of the women diagnosed with the disease have either never been screened or haven't been screened in the past 5 years. In order to acknowledge Cervical Cancer Awareness Month, we're here with Dr. Kathryn Kennedy from CARTI to go over everything we need to know about cervix cancer. Thanks for joining us today.
Thank you.
So let's go over, we talk all the time whenever we have these awareness months about the early screening, early detection. Why is it so important to do that?
It's so important for cervix cancer, especially because it's literally a curable disease. The earlier you catch it, the less invasive a procedure or treatment you may need to have, and the more likely it is to be completely cured. So if you catch it early, it may be a very simple treatment that you don't have to really worry about moving forwards.
Yeah, that way you have a plan in place and you don't have to worry about further along when it's a little bit more challenging.
Exactly.
So I know a lot of people, when they think of cervix cancer, they think of HPV, which is another kind of connecting factor there. So let's talk a little bit about that. Is that, kind of the only way you can get it? And then I know there is a vaccine for that as well.
Yeah, absolutely. So HPV causes about 90%, slightly higher sometimes, of cervical cancers. So it's so important to address because it's literally preventable.
Yes.
The vaccine is really effective. It covers the 9 highest risk strains of HPV, and kids as young as 9 can get it, and it's actually now approved for people up to age 45 years old.
Wow.
So even if you think you may have missed that window as a child, now you can get it, as an adult too, and it still is effective even if you've already been exposed to the HPV virus.
Wow.
So by reducing your risk of contracting the HPV virus, you reduce your risk of cervical cancer.
And we talk about screenings as well. So how often should people get screened in order to help prevent this?
It depends on how your PAPs have been, basically, if they're normal or abnormal. But if they've always been normal, adult women can usually get a pap smear every 5 years, as long as they're getting tested for the HPV virus as well. It varies significantly, though, based on your history and your age. And so I think it's very important that women always get a pelvic exam every year and then talk to their doctor at that time about whether a pap smear is indicated or not.
Okay.
But someone should at least do an exam once a year and talk to you about whether you have a higher risk or lower risk for development of cervical cancer, and then decide if a PAP is appropriate.
Yeah, so talking to your doctor is kind of the most important
thing. Talk to your doctor, absolutely.
And then finally, for those who maybe are not aware of cervix cancer or don't really know what to look out for, are there certain signs or symptoms that people should be aware of?
Yeah, it's tough because cervix cancer is often really asymptomatic in the early stages, so that pap smear is really the top priority. But if you have bleeding after intercourse or irregular bleeding, abnormal discharge, those would be reasons to go and see your doctor sooner and get checked. Pelvic pain and kind of swelling in the legs, those kind of symptoms can happen if it is a little bit of a later stage. And so definitely also reasons to go and get checked by a doctor.
Yeah. So just make sure you are up to date on all the exams that you need to have done, because really, as you just said, it's preventable if you're screened properly.
Absolutely.
Perfect. Well, thanks so much for joining us to talk about Cervical Cancer Awareness Month and, of course, all the wonderful things that CARTI does for Arkansans. And, of course, if you need more resources, you can go to CARTI's website.
Absolutely.